Hello, surgery kids! Welcome to Module 6, and this is the last coverage for the first lecture exam. If you notice, there is no Module 5 because Module 5 is supposed to be large animal instrumentation, which I realize is a part of the of the course syllabus of large animal surgery. So I am just going to void Module 5 and transferring it to just large animal surgery. And we're going to start with sutures, biomaterials, and hemostatic techniques. As Module 6, I will not be changing any of the assignment of module numbers para hindi na confusing. But when you're studying for the exam, don't look for Module 5, all right? All right, so we talked about the instrumentation last lecture. Now we are going to focus on the sutures, the biomaterials, and the hemostatic techniques that we use or we employ in surgery. All right, let's begin. Sutures have two main functions. Number one is to provide hemostasis for when we use sutures to ligate or tie damaged blood vessels or blood vessels that we have transected or we have to transect to do the surgery. All right, this would prevent continuous hemorrhage or blood escaping from the blood vessels into the body. And also to support wound healing. We use sutures to approximate or bring wounded tissues together. When we the second lecture exam is all about wounds and wound healing, and we will be discussing this in more detail. I am reusing my lecture from last year, so forgive any changes in font or in colors that is employed in this module. All right, now before the materials that we use right now for suturing, okay, hindi naman yun agad natuklasan before, right? There are other materials that have been used since its development as sutures, right? Number one would be horsehair. Horsehair is known to be so strong and it is very easily found, whenever you have horses. And they are used by medical practitioners before as sutures, to hold wounds together. Another raw material that was used before were animal tendons. If you remember, animal tendons, para siyang, I don't know, alam mo yung consistency ng kawayan? yung meron kang pwedeng tanggalin. Meron strands, so those are used. Animal intestines, when they're processed and manufactured in a certain way, it can be used as sutures, and one suture that we are still using is based on that. And of course, silver, for when you need more tensile strength for your sutures, you need them to be strong, then the other materials are not good because they're too soft. So metals are actually used as sutures. Now, what do we want to focus on in terms of characteristics of the sutures that we use, right? Number one would be the surface characteristics and coating. What does the surface look like? Is it rough? Is it smooth? The size of the suture would also be dependent on the wound that we want to approximate. The absorption rate, we will discuss this in more detail. Capillarity, tensile strength, flexibility or how bendable it is, relative knot security, how secure the knot it makes, and memory. Right? If you fold them or if you manufacture them bent in a certain way, will it be hard for us to straighten them, right? For example, yung mga binebentang Christmas wrapper, okay? Di ba nakabilot na yan? So those have actually good memory because even if you unwrap them from the pagkabilog, hindi siya nagfa-flatten agad. So the same characteristic as sutures. Some are manufactured looped, right, in a certain way, and it's quite hard for them to forget the way that they were manufactured. And it's sometimes hard for us when we use them already and we want them to be straightened out, right? So now let's discuss the different characteristics of a suture. Starting with its size, right? The sizes of suture materials depend on the circumference of the thread, all right? And it is based on what we call USP size, right? So from the smallest, 11O, to the largest or the thickest, which is 6, all right? And as the size increases, the strength of the suture material increases as well. So when you see these sizes like 9/0, 5/0, 4/0, 3/0, 2/0, you know that it's actually going thicker and thicker. And why is this important? Why is it that you have to know the thickness that you need for a certain procedure? Because the size of the suture that you are going to use must match the strength of the tissue that you have to oppose. All right. For example, the weakest tissue, in a way, if we can say that, is fat. Okay, the fat is easily friable. You can remove it just with minimal manipulation. It's not really that strongly attached to the subcutaneous muscles or the skin. All right, so it would need a very small size of suture. And as we go up, in terms of strength, muscles would be stronger, but the skin, the fascia, the ligaments, and the tendons would be the strongest and would require bigger suture than what you would require for fat in the muscles. And the rule is that you must use the smallest diameter that can adequately secure incised or wounded tissue. Now here is where your experience of other vets would be beneficial, because it takes experience for you to know if a certain size of a suture is enough or if it is inadequate in opposing tissues. Like for example, a 3/0, okay? A 3/0 is good enough to suture skin of a cat. And it is sometimes even good to suture skin of a small dog. But sometimes because of the difference in size of the animal, like for example, a big dog, okay, or a fat one, right, you would require a bigger amount of suture, even if it's the same tissue. Okay, if it's the skin of a cat or a small dog, usually 3/0 would do, but you might need to go to a 2/0 if it's a bigger dog, right? Even if it's the same skin. Okay, so the usual sizes that we use is just from 0 to 3 for small animal. For soft tissue surgeries like abdominal surgeries. For eye surgeries, you could go from 4 to 6. Sometimes I even go to 7, depending on the size of the animal, the size of the tissue that I need to suture. All right. So again, it all depends on experience. But usually you stick with that range. Alright. Now, why do we have to use the smallest diameter? Bakit hindi natin pwedeng, halimbawa, lakihan? If 3/0 yung smallest diameter that could suture skin, why can't we go to a stronger size of tissue? Stronger size of suture. Okay? Because there will be a mismatch. You would want to match the strength of the suture and the tissue. If you use oversized sutures, okay, you're using a much bigger suture than the tissue needs. That will cause excessive tissue reaction. That could cause your tissues to strangulate too much. And that could cause your wound to never close, to close later, or even cause or initiate infection because of that non-closure. And with undersized sutures naman, you cannot oppose the wound edge well. You cannot, hindi mo kayang pagdikitin yung wound edges. There is no tension created to keep it together. So again, your wound will not close or will close delayed and will lead to infection. All right. So the way ng pagtimpla ng sutures is, again, I started this way. My professor said, always use a 3/0, always use a 3/0. And then I encounter a dog, which I thought a 3/0 would do. Come back after 3 days, the dog is, there's a part of the wound that is open because I used a suture that is too small. So again, it's based on experience and that. I usually use 3-0 for the abdomen, the peritoneum, but when I go outside for the skin, I use a 2-0, right? Again, there's no wrong thing here. It's just your surgical judgment, which will be tested, right? All right, this is an example of a packaging of a suture material, which is monocryl. Monocryl is a absorbable suture. Quite expensive if you buy it here as branded one, as Ethicon. But I'm just using this as an example, all right? Monocryl is the brand name. If you look at the word below that, that's polyglycaprone, which is the generic term for what is, basically the active ingredient or what the suture is made of, right? It is describing what kind of filament it is, undyed. We'll discuss all of these characteristics in a bit. I'm just familiarizing you. The 4-aught here, okay, that's the size. Okay, that's a 4-aught. In a metric system, because 4-aught is the USP size, the metric system would be 1.5 metric. It also shows the length of the suture material, which is 18 inches. All right. The length of the needle, which is 13 millimeters. Sorry, the thickness or the circumference of the needle, which is 13 millimeters. All right. This did I get it right? Oh no, sorry. This is the length of the needle, which is 13 millimeters. This is a straight needle, as you can see here, and it is a reverse cutting needle. So when you cut the needle transversely, this is what you will see. All right. So let's talk about the other characteristics: absorbability and absorption rate. Right? The absorbability is the ability of a suture to be broken down by the body and how quickly it is absorbed. All right? And when we categorize different suture materials into their absorbability, you will get this diagram. All right, starting from the top one, absorbable on the left side, you have short term, medium term, or long term, meaning it's just a matter of days or weeks or months until that suture is broken down by the body's immune system, and that could be further classified or subcategorized into if it is natural or synthetic filament, is it braided or monofilament in terms of the surface. All right, so this is a good summary of everything, but it only says the brand names, basically Vicryl, Vicryl Rapid, Polysorb, Monocryl, Maxon, PDS2. And it's, if you're not yet well versed with it, which I don't expect you to be, of course, it's fine. So it's just, do you have to memorize this? Yeah, for sure. But focus on the suture materials that I will be discussing, and don't concern yourself with the others because they're not being discussed because you don't commonly use them, right? So the other suture characteristics would be capillary action. This is the extent of fluid absorption of the suture material, okay? This is a question of if the suture is resistant to fluids and everything the fluid contains, right? Let's go at it a bit. Tensile strength would be the measure of the ability of a material to resist deformation and breakage. Flexibility, basically how easy for you to handle the suture material, how bendable it is when you're tying and securing the knots, how strong the knot is, which means how much strength it needs for it to be broken or untied. And flexibility is I repeated that. This is memory, sorry. Flexibility should be memory. This is the inherent capability to maintain or return to its original shape after manipulation or deformation. All right, surface characteristics and coating. All right, the surface of the, what do you call this? Nung sinulid, kumbaga sinulid, okay? It affects the amount of friction that is generated between the contact between the suture material and the tissue, okay? There's that drag. When your suture has high amount of drag, makikita mo na nahahatak niya yung tissue papunta sa kanya while you're pulling the suture through the tissue, okay? Sometimes we want that, sometimes we don't. All right. What we usually want is that drag is decreased when we are using it in internal organs. In the skin, which is a more resilient tissue as compared to the stomach, the intestine, the liver, the urinary bladder, we don't want that drag. We don't want to have that kind of friction. That is why we want certain characteristics for them, which is if it's braided or monofilament. I don't know why my PowerPoint is so disorganized. I'm gonna discuss that in like 2 slides away. All right. The question of what is an ideal suture is that it's easy to handle, secure hold after knotting. It generates minimal to no tissue reaction. It would inhibit bacterial growth to resist the development of surgical site infections. It resists shrinking in tissue so that when your tissue is healing, it will remain, it will still be there, right, to hold the tissues together. Non-allergenic, non-carcinogenic, and non-capillary, meaning it is not absorbing fluid, because as we know, when fluid forms in the wound, that is usually composed of like dead neutrophils, bacteria, and such. You don't want your suture to absorb that and be a seed of infection in that area. And this all of these, is there a suture that would classify, that would have all these characteristics? No, it does not exist. However, the goal of every manufacturer, of every designer of sutures, is that you have to create something that is very close to the ideal. Okay? The quality of your suture matters. I'm not going to understate that. It matters, but your technique in utilizing them matters even more. Right? So I don't care if you are going to use branded Vicryl or if you're gonna use a normal PDS, a generic Vicryl. What matters to me is that you're using it the right way, because the quality is irrelevant if you're not using your suture the right way. Okay? So basic classifications based on absorbability, origin, it could be natural or organic, synthetic or metallic, and structure. Okay? Is it a monofilament or a multifilament? Okay? Let's start with structure because this is the basic classification. Okay? You can have a monofilament suture material, which is it's just composed of one one strand, right? Or you could have a multifilament wherein it is composed of multiple strands. Okay? Now, the monofilament, of course, because it's only composed of one strand, it has less tissue drag or less friction between the suture and the tissue. The absence of the usual interstices, the area where the different filaments join, that is actually good for harboring bacteria and fluid, and that is basically absent in a monofilament, which is good. However, this is more prone to damage by sawing and instrument handling. Sawing is when your suture encounters another suture, another layer of the suture. Pag nagtatali ka na, that is when your suture material undergoes sawing, because they're in contact with each other, and that could actually damage it if you saw too much. But usually it's not a problem. In multifilament, because it is composed of multiple strands, of course, you have more tissue drag. Nagtatahi ba kayo? Nagtatahi, You see yung thread na gamit nyo, yung sinulid na gamit nyo, that is a multifilament thread. That is cotton. It could be cotton or silk or whatever. It's usually cotton. Right? That is multifilament. Na kapag ginupit nyo siya, try nyo paghiwa-hiwalayan. Marami kayong strands na makikita. Okay? That's a multifilament. Now, if you look at your hair, if you can, girls, you have long hair, or guys, if you have long hair, you could see it should be monofilament. Kapag multifilament yan, may split ends yan. Alright? And that actually renders it weaker. Okay? So this is actually more flexible, more pliable, and easier to maneuver than the monofilaments. Okay? That's how I envision it. Okay? Now, the surface of multifilaments can be arranged in 2 ways. Okay? Oh, sorry, not the surface. The thread of the multifilament suture materials have 2 arrangements. It could be braided, parang tinirintas. Okay? Or they can be twisted. Okay? Now, would it Is there any difference in strength-wise? May difference ba siya pagdating sa anong kaya niyang gawin? Not really. It's just that the twisted tends to uncoil faster than the braided one. And most of the suture materials that we use are actually braided ones. Okay? So, just a table of differences. Monofilament in terms of number of strands, flexibility, the surface, knot security, drag, and capillary action. All right? So, suture origin. Okay? Saan ba galing yung mga sutures natin? Number one source would be a natural or an organic source. It could also be synthetic or man-made, or it can be metallic. Okay? Natural or organic suture materials are made from natural fibers, right? It could be from silk, which is, from silkworm, it could be from an animal, or it could be from plant, right? And since it is made from natural raw materials, it is found to cause more tissue reaction. Okay? As compared to synthetic, which is made from man-made polymers, wherein they themselves designed these polymers and how they will bond to each other. So it is less reactive in tissue. While metallic, these are made from processed metals like stainless steel and titanium. This is usually just the two metals that we use as suture materials, stainless steel or titanium. Some orthopedic implants are using stainless steel and titanium. Before, they were using brass, they were using cobalt, they're using some copper. But then when those disintegrate inside the body, that could cause metal poisoning to the blood of the person, so they stopped doing that. Okay, so let's start with absorbability. Okay, when we say suture is absorbable, what do we mean? Okay, usually, absorbable sutures would lose their tensile strength, their innate strength, within 60 days of tissue placement. Okay, hindi sila ang dating kasi pag absorbable, natutunaw. Okay, just natutunaw sila. Not really natutunaw, they're just, broken down in a way, either by phagocytosis. Organic or natural suture materials are broken down through phagocytosis. Synthetic suture materials are broken down through hydrolysis. And this, the way that you choose these suture materials must be dependent on how long you expect the tissue that you're suturing to heal. Okay? Skin takes around 7 to 14 days. Some mucosa of internal organs would take longer. Okay? So the way that you decide on what suture material to use is dependent on what surgery you're doing. Okay? Now, kapag sinabing absorbable, parang yung mga natutunaw, nawawalan yung loose strength. When we say non-absorbable, hindi ibig sabihin niya na hindi sila natutunaw. Okay? It just means na they maintain their tensile strength more than 60 days. Okay? More than 60 days. And they cannot be broken down by the usual phagocytosis or hydrolytic mechanisms. These sutures, if they stay in the animal's body more than 60 days or more than the time that they can be broken down, they're usually encapsulated or walled off by fibrous tissue because they are foreign bodies. Okay? So you must not place these suture materials, non-absorbable ones, in infected or contaminated sites because you expect that the amount of immune cells and the immune mechanisms directed towards that site is heightened as compared to the other ones. Okay? So now, let's start discussing the different absorbable suture materials. Let's start with absorbable suture materials, starting with the cheapest one, the catgut or the surgical gut. Okay? This is a natural, absorbable, multi-filament suture material. When I describe suture materials, expect that 3 adjectives to be there. How they're classified, depending on the source, its absorbability, and how many filaments it has. Okay? Now, catgut is actually called cattle gut. Okay? It's not from a cat. Okay, it's a misnomer when they think catgut. It's from the gut of a cat. It's actually from the gut of a cattle. Okay, it's derived from the serosa of the intestine of cattle or the submucosa of the intestine of the sheep. It is 90% collagen, and in some musical instruments, it is still used as the strings before steel and synthetic polymers were developed as strings. For some, they still prefer this, but for most, they now prefer the synthetic polymers because catgut breaks easily. Okay, that is the ultimate complaint about catgut. Very brittle. It just breaks on you, right? It loses its strength rapidly after placement in tissue, and it was found to cause severe inflammatory reactions. Plain catgut. Okay? That is why the plain catgut is treated with chromium salts to resist body enzymes, which could cause less tissue reaction and to slow the absorption process, so renders it to be stronger. Still, there was an observed loss of 30% of the tensile strength after only 7 days, and complete absorption is in 60 days. All right. The knots made with a suture tend to loosen easily. So when do I still use this? Okay, I always ask myself this. Do I use this? Yes, but I don't use a small size. I usually use a 0 or a 1, and I use this to ligate like ovarian pedicles during spay. Number one, it's cheap, especially during spay and neuters. I would choose to use chromic gut as compared to Vicryl or polyglactin during spay and neuter campaigns, just because it's a spay and neuter campaign. It's free, I have to save money, and it works as long as I use this properly and I am sure that the knot I made is strong. Okay. Next, most commonly used absorbable suture material is the polyglactin. Polyglactin 910 is the generic term for Vicryl. It is synthetic, absorbable, multi-filament, and the main indication for polyglactin is vessel ligation and subcutaneous culture. It is soft, very flexible, so it is very easy to handle even for new surgeons. The knot you make is quite good, and it has minimal tissue reaction towards any part of the body. The material is 90% polyglycolic acid. However, since it degrades faster in alkaline environments, it is not recommended for urinary bladder closure. It can be used in contaminated environments, like for example, wounds. Complete absorption is observed in 70 days. Now, if you're gonna remember something, you remember the complete absorption, okay? The number of days. So, Vicryl. When we talk about Vicryl, of course, they have a different call this literature in terms of gaano kabilis natatanggal yung strength niya. Vicryl is pretty strong. Okay, it only loses 25% of its tensile strength after 2 weeks. It loses half of that tensile strength in 21 days, and usually the skin is healed already after 2 weeks. Call this urinary bladder, stomach could be done in between 7 to 10 days. It's good already. Now, there's another one which is Vicryl Rapid. I don't know. Which it is it is absorbed faster, I guess. Loss of 50% of tensile strength after 5 days. Loss of 100% of tensile strength in 14 days. And complete absorption at 42 days. So these are for rapidly healing, we call this, parts of the body. Gums, for example, the tongue. So this is actually what dentists use. Okay. And another one which has been found to be very effective in preventing infection would be the Vicryl Plus antibacterial. As you would expect, it's branded, it is expensive. The suture is lined with an antibacterial agent which helps fight off any bacterial contamination in the wound site. Any guess what antibacterial is infused in the suture? Any guesses? Do you know why Safeguard was said to be an antibacterial soap? When you say antibacterial, it should fight a bacteria, right? It should have an action against bacteria. Either it's a bacteriostatic or a bactericidal agent, right? Because Safeguard before used to have an antibiotic in it, okay? That is what we call triclosan. But now, when you look at if you're using Safeguard at home, look at the packaging, try to look at the ingredients and try to see if they still have triclosan. I think they stopped years ago, because it's hard to undergo regulation. It's hard for your product to be approved if you have that kind of active ingredient, and then you have must, of course, since if it's containing antibiotic, it has to pass a lot more restrictions. So I think they stopped, but they never dropped the fact that it's an antibacterial soap. Anyway, right? So basically, in animal practice, you're just flip-flopping between that. Either polyglactin, catgut. Later, we'll discuss silk and nylon. Basically, that's it. Polyglycaprone is actually a very common suture material in other countries. Okay, I don't know, in developed countries. They don't use catgut anymore. They rejected that. So monocryl is one good thing they have. Synthetic, absorbable, and it is monofilament. Okay, so as compared to Vicryl, which has more drag, which is, it is easy to handle, but if you want a monofilament, if that is what is indicated in your surgery, then monocryl is the way to go. It is known for rapid absorption, which makes it the suture of choice for intradermal skin closures and rapidly healing tissues, oral and pharyngeal mucosa, subcutaneous tissue, urinary bladder. It has a high degree of memory, so medyo mahirap siya i-handle, but actually it's not, it's fine. I've used monocryl many times. It is not recommended for closure of fascia and tendons though, because fascia and tendons heal slower, and this one has it is absorbed fast. It loses 50% of its tensile strength in only 7 days, 80% in 14 days. Complete absorption is 90 to 120 days. Okay? Polydioxanone is PDS2, also another common thing that is used out of the country. Synthetic absorbable monofilament. This is for slowly healing tissues, for extended wound support if you expect that the healing would be delayed, or if this tissue has that, delayed level or delayed healing associated with that tissue. Okay. May also be used in pediatric cardiovascular tissue because you want that as the animal grows, okay, as the wound heals, it would maintain that strength within that tissue as this organ is continually moving. Okay? So complete absorption of this one is 180 days. So you would expect this one it remains longer than the other sutures. Silk. Silk is what we use to practice your suture materials. Number one, it's because it's cheap. But still, it is also very much used in small animal practice as a skin suture. Okay, it is non-absorbable, meaning you need to remove it later on. It is the first non-ab suture material used in surgery. It is organic in nature from the silkworm, the protein fibroin. Okay. It is highly flexible, but it has very poor knot security, which you will experience when you practice your sutures in the laboratory. Whenever you make knots, you could easily remove those knots. And it has high tissue reactivity because it is of natural source. It is contraindicated in gastrointestinal surgeries, urinary bladder closures, and in any contaminated surgical sites. Number one, because it has very poor knot security. You do not want to use a suture material na madaling matanggal yung tali when you're sealing, organs which needs to be sealed. Okay? Yung kailangan maganda yung pagkakasara mo, like the intestine, the stomach, the urinary bladder, that any leakage of the contents could lead to peritonitis. This loses tensile strength by 6 months. Complete absorption is 2 years. Again, it's classified as a non-absorbable one. Polypropylene. Polypropylene is very much, what do you call this? remembered because of its blue colored suture material. Very characteristic for polypropylene. It is synthetic, non-absorbable monofilament, and this is the suture of choice for cardiovascular surgeries. Again, if you listen to medical dramas like I do, or if you watch them and pay attention to what they're saying, you always hear cardiac surgeons ask for proline, 4-O proline, 2-O proline, and such. Okay? So, this is least likely of the sutures to cause infection in wounds. It has minimal tissue reaction, very good characteristics right here, and it is dyed blue because you want to enhance the visibility of the suture against blood and blood vessels. When you have a multifilament suture material like Vicryl and silk, they usually, when they encounter blood, they just become brown or dark. You lose sight of them, especially if you are suturing something deep inside the animal's body. But with proline, because it's monofilament, it's colored blue, it retains that blue color. Nylon, very much commonly used. One, it's cheap, and it's the non-absorbable suture of choice for superficial skin laceration closures. If you've ever been, had a big wound, they usually close it either with nylon or with silk. It depends, but usually I think they were suture. Because I got a big knee wound. I was umakit ako ng pickup truck when I was in high school. Nagtulakan kami lahat. That was like a class, half of the class. Sakay kami pickup truck sa likod. Nagtulakan sila. So yung corner nung binababang, yung harang ng pickup truck, yung binababa para makasakay ka. I grazed my knee. When I say graze, it went so deep, yung gas-gas niya, that it had to be sutured. Okay, so they use nylon. I remember that. Yep. And I don't know, they call this. They use nylon because I remember the packaging there. Then I read about this that it's only used for like superficial skin laceration closures. It felt deep though. Like, I didn't see my bone though. Yeah, that's why I when I wear, what do you call this? I don't like wearing dresses because I have a huge scar on my knee. Right? Never mind. Okay. Material, polyamide. Poor flexibility and not security, but it has good tensile strength. It is dyed suture, either black or green. Okay, ganun lang siya. Stainless steel. Metallic, non-absorbable monofilament. Again, this is metal. It is indicated for orthopedic surgeries and open thoracotomies. This is inert, minimal tissue reaction, but yung ends niya na kinat mo, remember, para siyang alambre, okay? It can cause irritation and trauma to tissue. So you have to make sure that you cut it well or you bend it inwards, okay? What else? So, how do you use it for orthopedic surgeries? You could use that as a cerclage wire, CERCLAGE, cerclage, right? You're tying broken bones together. First, you put a pin inside, this big rod inside the intramedullary space of the bone, okay? And then, if it's unstable, you wrap the whole bone with alambre, or basically stainless steel wires or stainless steel suture. Okay? So, what's next? How do we choose a suture? Okay? Rules. The rule is wounds are closed in a manner that promoted optimum healing in minimum time. Okay? You want those wounds to close at the minimum possible time, but the healing should be really good. Okay? So the length of time needed by the suture to maintain strength until the tissue is healed is one of the biggest factor, okay, when you decide what suture to use. Okay? Gaano ba kabilis maghilang skin? Gaano ba kabilis ma-absorb tong suture na to? Those two things should meet, or dapat mas maunahan ng pag-heal yung pagde-degrade sa suture. Okay, and then it is followed, of course, by the other factors like your experience, the tissue to be sutured, patient factors which could affect the rate of healing of the animal, and the suture characteristics. So there's some this is a table of how suture is selected. This is from I forgot. This is not from Fossum. I think this is from like American Association of Animal Hospitals, I guess, that they have a choice of what to use. Tipo, halimbawa, if the skin, if you're suturing the skin, you use a monofilament with a cutting needle, absorbable, non-absorbable, then you use intradermal closures. So I just place this here to help you when you decide on your sutures. During surgeries naman, for me, personally, I don't really meddle with your choice because I'm trusting that you would choose wisely, when you decide on what suture you have, and that you have a lot of factors that you're considering. I'm more particular with the size of the suture that you're using. Okay? So, well, that's for me, of course. Some professors might want you to like use ganito for the skin, use ganito for peritoneum. That's on them. But for me, I want to see how you decide it for yourself. Okay? Because you're not gonna be students the entire time. You're students now, but right now I want to see na agad how your judgment works, how your decision making process is happening. Because you're not here to just listen to me and just follow what I say. I give you information, you use your brains to make decisions based on that information. Okay? Yeah, so you won't see students of mine, this is just what you use for this is what you use for that. I'm going to have to ask you why, and the reason for it should not be, sabi po ni doc ganito. That's the, I don't know, man. I think that's a very bad way of learning, because what are you gonna blame me if your suture fails? Sabi ni doc, Mika, ganito dapat. What if it fails? But it's not a sure deal. You have to, every decision that you make in surgery, you have to make sure that it is well thought of and that you could defend it. Not to me, but to the client as well. So ngayon pa lang, masanay na tayo na ganun dapat matuto. That you could justify your own decisions, not because someone said it, someone said so, and that you don't have any choice. Because who's gonna answer for it when something happens? It's gonna be you, right? So at least be what do you call this? Be vigilant in the decisions you make during surgery. If I'm not with you, be very well knowledgeable about whatever it is you do. Okay? Because at the end of it all, it's your decision. It's not a good thing to like just base on it because someone older did it the same way. If we have done that, if all veterinarians did it, we'll still be, I don't know, castrating sheep and goats with the normal way and such. We would still be using catgut for everything, Anyway, so I just use this all. I just place them all here. I trust that you could, read that. Okay. Now, how to remove your sutures. Remember last lecture I showed you the suture removal scissors? You may curve sa bottom blade, right? So when we remove sutures, when it is time to remove sutures, the external wound is healed and your suture is no longer needed, okay? And these skin sutures, especially if they are non-absorbable, they need to be removed. Okay? Because they can be the source of infection. So what do? You clean the area with an antiseptic. Usually the sutures has parang may mga namuong scabs around it. So that's crusted serum. And you can remove that easily with hydrogen peroxide. And when you're shown with this one, okay? Yung broken lines dito, that will be the suture under the skin. The knot that you see is the one that you see outside. Okay, so you can use your thumb forceps, or if yung suture dito, na yung mga ties na to, you may grab here. If it's long enough, then you could hold it with your fingers. That's fine, as long as it's clean. Okay? You lift one end of the suture and you cut the opposite end as close to the skin as possible, where the cut here words are located. Okay? Then you gently pull the suture out the other side, taking care na yung kinut mo na portion na nasa labas ng skin should not go inside the skin again. Okay? Because if you cut it too far from the skin, yung part ng suture na nasa labas, na nadudumihan, na pwedeng merong bacteria na napunta doon, ipapasok mo siya through the skin and that could cause infection. Okay? So, this was an activity that I used before. It's fine. Just hope that you know each of these names or of these, ano yung mga codes na nandyan. And in the Google Drive, I also have the link in the same post that I shared the video for this. Meron the knot tying manual in case that you're interested in learning how to make the knots with your hands. You could use your shoelaces. Mas maganda kung yung round shoelaces, not the flat ones. And you could learn the ties. Okay? Again, this will be covered in the laboratory part of the surgery. And if you want to keep those, those references, save them now. Kasi at the end of the semester, I'll be closing down the classroom and then you will not be able to access all the files anymore. Okay? Moving on, biomaterials. Oh man, I spent 50 minutes for that. Biomaterials. These are any substance, basically, that has been specifically engineered to be used for medical use, okay? And for a variety of uses. Number one would be the tissue adhesives, the forever useful mighty bond, skin staples, and the surgical mesh. Okay, each of them would have different indications, and we will be discussing them one by one. Tissue adhesives are substances that rapidly polymerize o madaling nagdidikit-dikit in the presence of moisture to make a strong, flexible bond. Okay, the active ingredient in these is what we call cyanoacrylates. Okay, and this is vet bond. The cheaper version is the mighty bond. All right, and this provides quick, convenient closure of minor, shallow wounds. And since it is only it can only adhere so much to itself, it is only indicated for superficial, clean wounds. Okay, less than 5 centimeters in not in depth, in length. Okay, so if this gets in contact in deeper tissues, this can cause granuloma formation, dehiscence, tissue burns. Okay, so ideally what I do with this one is just use this on the side. I do not really put it on top of the wound. Okay, and you could expect it to be done in 2.5 minutes with healed tissue at 7 days. Okay, now this video shows it being placed on top of the wound. This is a pig, actually, I think. Yeah, this is like a model pig. Right, so you have that one. Yeah, see, they're placing it on top of the wound itself, but they're making sure that the wound is actually closed, para lang siyang sure na cover on that wound, para walang mangyaring masama. Right, no, it's a long. In spay and neuter campaigns, a mighty bond is used commonly not to close the wound itself, but remember, in spay and neuter campaigns, it's a free service, so you don't expect these owners to be looking at their pets all the time and taking care of them because they afforded, a free service. So, or sometimes spay and neuter campaigns handle animals which have been caught from the streets. So wala masyadong, yung post-operative care is non-existent for them. So you have to make sure that the wound that you made will not be infected kahit minimal yung post-operative care na nare-receive ng pasyente. So that's why you have the mighty bond. What we do is that yung skin directly lateral to the suture site, to the wound site, yun yung pinagdidikit namin. So parang sinasandwich namin yung suture wound sa gitna para hindi siya yung directly in contact sa sahig, directly in contact sa hangin, para pag nakauwi na yung aso, okay na. Hindi siya masyadong luwang-luwa. Kasi madalas yung iba, natatanggal yung suture kasi hindi na ma-mighty bond. That's fine. Staples is one of the easiest, fastest way to oppose your wounds, right? It uses stainless steel staples, and you have your own stapler for that. Okay, we don't use the normal paper stapler for this. We have a wound stapler. It provides good wound edge apposition, but it also causes slight tissue eversion. Okay, tingnan mo, nakaluwa ng konti yung skin na ini-staple mo. And skin staples, since these are non-absorbable, they're metal, they must be removed after 7 to 14 days. Okay? So this is how it's done, right? So as you can see here, you put the skin, the two edges together, and then the stapler brings them together. Something like that. So you need your thumb forceps for this. All right. Okay, so you approximate them. There's a line in the middle of the stapler. Did you see that? Sorry. There's a line there sa gitna ng stapler. Okay, that should correspond to the suture line, to the wound line. Okay, naman nakatapat siya doon. Right. And yung staple. Nag-malfunction. All right. Let's try again. Okay, you have your thumb forceps to bring the skin together. You click. There you go. All right. So this requires your subcutaneous tissue to be apposed already. Okay. Remember, our wounds are closed in 3 layers: muscle, subcutaneous tissue, and the skin. So this requires your subcutaneous tissue to be apposed already. See? And it's good. All right. So this is also the way that we remove them is also important. All right. We don't want the tissue that it has been opposing na masira siya ng pagtanggal ng staple. Kasi nadikit na siya eh. Bakit natin siya para lang matanggal yung staple wire, masisira yung tissue. So there's also a staple remover for that. Okay? So this is how it's done.
So now they become straight, and then the staple will literally simply lift out of the wound, very simply. So we push down, spreads it, and as it straightens it, it just pops straight up. If you don't have a staple remover, you can also use a needle driver or a clamp and place it under the staple and just spread, and basically spreading is doing the same thing. It's straightening out. This is much less painful for your patient though if you can use one of these devices, because as I said, it straightens everything out and simply pulls out, and there's no pulling. Sometimes if the bending apparatus doesn't really straighten them completely, you can just, as you're stapling, rock it gently. And here's an example with just a needle driver where literally you just spread, so you're trying to open those tines, and as it does, it'll come out. If you're going to do this, it's usually better to do this on a patient who's asleep, because it can hurt to remove staples this way. And again, sometimes you do need to kind of rock from side to side. So now they become...
Okay.
So use a needle driver or a clamp and place it under the staple and just spread, and basically spreading is doing the same thing. It's straightening out. This is much less painful for your patient though.
So it becomes letter V times, right? There you go. See? And the tissue that you stapled is still intact. As compared dun sa papel na gusto mong natanggalin yung stapler, we can't do that here because we can't see the other side. It's under the skin. So this is how we do it. We bend the staple in the middle. That brings the two sides outward. Now, doc, how do we do this in a live dog? You can with proper restraint. With proper, you could sedate a little bit. Okay? This is without the stapler. This is without the, what do you call this? Stapler remover. You could use a needle holder. But then again, see, it opens the wound a little bit as compared to the other one. Just, I would prefer this method any time of the day, because the tissue here is minimally handled as compared to the second one. See? Yeah. This can be done rather well with patients without even need for sedation, just proper restraint. But if you need to sedate, then you might need to consider why you're putting staples in the first place. If you're putting staples in the first place, you are already expecting that you will be doing this process of removal after 2 weeks. So, bakit ka maglalagay ng staples sa aggressive na aso? Okay? When kailangan mo siyang tanggalin in a very, very delicate way. So you might need to consider using absorbable suture material instead for those aggressive animals para hindi na nila kailangan bumalik for suture removal. The surgical mesh, okay? It's basically para siyang screen, okay? That could be absorbable or non-absorbable, that is indicated for hernia repair. Okay. How do hernia happen? Okay. Basically, ang hernia, may part ng muscle wall in the body that weakens, that it's supposed to enclose a cavity. Then, pag nag-weaken yung muscle na yon, it causes the abdominal contents or the thoracic contents to be extruded out from that cavity. So this could happen in the umbilical wall, it could happen in the inguinal wall or the perineal wall, even the diaphragmatic wall. Okay? And sometimes when you want to repair those hernias, the muscles that are supposed to wall these holes are too weak. Tipong wala ka nang masuture na pabalik dahil nag-atrophy na sila or masyado silang sira, masyado silang friable. So you replace that muscle with a mesh or with a screen. And this can be made from polypropylene or polyglactin. They're generally elastic but cannot stretch well when placed in a young animal as it grows. So usually if you have placed it in a young animal, there's a possibility that this would fail later on in their life. But sometimes it doesn't, and they may stay inside the body for longer support and strength. So, for example, you have this hernia to repair. Okay, you have this hole, diba? This, I think, is a perineal hernia. Okay? Dapat walang hole dun sa area yan. Okay? The abdominal contents should be intact. But since the perineal wall is weakened, so you have that hole wherein the intestinal contents are escaping towards the pelvic area. and have that risk of you getting bit and them getting stressed, para lang matanggal yung suture when you have a lot of sutures to to choose from. Okay, so what you do is you have a mesh. Okay, you're gonna replace that wall with a mesh. You're going to cut it in a certain way and shape it in a certain way that will fit the shape of the hole that you want to fill. Okay. All right. Basically, you're sealing it. Okay. You figure out that that's the size of the hole that you need to fix. You if you fix mo yung what do you call this, the mesh in that shape para hindi siya mawala sa shape na yan as you install it, and then you attach it to the remaining muscles around that area. Okay, this is how you fix a perineal hernia with a surgical mesh. Surgery 2 will have I think that's module 2, hernias. So now you see, yung hole kanina na nilalabasan ng mga intestines, it's now sealed. Okay? So that is it for biomaterials. Last part of this module. Be hemostatic techniques. Okay, hemostasis as a word means the process of making bleeding stop or keeping the blood inside the blood vessels. Now there's a lot of ways that we already know how to stop bleeding. Okay, like for us, what do we do when we have a wound and it's bleeding? Number one, we apply low pressure with gauze sponges. We clamp it with what do you call this? Hemostatic forceps in surgery. Vessel ligation is also one. When we clamp with hemostatic forceps, okay, two things can go down. One, you clamp it, you leave it there for a while until it clots in that area. And when you let go of the clamp, it's fine. But if it's not, especially if it's an arterial bleed, you ligate that vessel. You tie that vessel up. Okay? Number two, topical hemostatic agents. Some have actually used ice, as to lower the bleeding in that area. But again, you can't do that in an anesthetized animal because you're gonna worsen the hypothermia of the animal. And electrocautery is one that is commonly used right now. So the way that you make bleeding stop would depend on the size and nature of the vessel that is currently bleeding. Is it arterial or venous? And that's how you decide how to control it. How do you know if the bleeding is arterial or venous? Arterial bleeding squirts. Okay? Remember, the blood goes into the artery at pulses. Kaya ka may pulse rate sa mga artery. May pulse. Meron siyang certain pressure. Okay? So when it bleeds from an artery, that blood goes out with a certain pressure. So it squirts. With venous bleeding, if it's a vein that is, severed or punctured, the blood from the vein pools. Okay? Bumabaha. Hindi siya nagsisquirt. Okay? Bumabaha. Okay? So, you'll have an idea with that. So, number one for topical hemostatic agents would be bone wax. Okay? This is a sterile mix of beeswax, paraffin, isopropyl palmitate. And how does it control bleeding? It usually is controlling bleeding through what we call tamponade effect. Okay? A small amount of this wax is pressed into like bleeding channels of bone. This is usually used in spinal surgeries. Okay? Wherein you are removing a part of the bone or a part of the vertebrae to get access into the spinal cord, and you expect a lot of bleeding to happen there. You cannot use hemostat. You cannot use gauze sponges in that area. What you could use is bone wax. And basically, you're stopping the bleeding by packing that area with bone wax. This is non-absorbable, so you must use it sparingly. It may act as a foreign body and become a nidus for infection, so you need to remove it after. Okay? So, how do you do it? It's packaged like that, a rectangle. It's rather small, but you don't need so much to it. Okay? You cut pieces of it, you knead it a bit, and then you just plug it into certain areas of the bone that is bleeding. Okay? And you expect it to bleed. Gel foam. Gel foam is a absorbable gelatin sponge. This is basically a physical matrix which initiates clotting. It has high absorption, so it tends to swell when it absorbs blood, and that swelling exerts pressure on the wound. Okay? It must not be left in infected areas wherein it can act as a nidus and exert unnecessary pressure in adjacent organs. So you can cut it in different ways and cut it circularly. You can cut it square for it to fit that area wherein you need to pack it. Kung gaano kalaki yung nagbe-bleed na area. Okay? For example, you're getting a biopsy. For example, this is a slide from surgery too, wherein you're doing a partial liver lobectomy. You see the liver. You see that small, I can't add. You see this area here where it is lighter in color than the rest of the liver? You see this one? My laser is there. I'm going to remove the laser. Okay? See that? Now, you want to take a biopsy of that to find out what it is. Could it be a starting tumor? Could it be a cyst? And all that. So you want to remove that part of the liver. What you could use is a biopsy punch method. Okay? This is a biopsy punch. Okay? This is a blade here. Very blunt blade. Okay? And what you could do, you expect the liver to bleed whenever you cut into it. Okay? Because it is a very parenchymatous organ. It has a lot of vascularity inside. What you could do is prepare gel foam at the start before you cut into the liver. You prepare the same size of the biopsy here. So you use the biopsy punch to remove that part of the liver that you want to be biopsied. So it will, ang tatanggalin lang niya is the same size as this biopsy circle here. Okay, so you remove that. Of course, bleeding would happen, and for you to control that, you can't, just use gauze sponges. It's such a big tissue that you removed. So you can place gel foam into that hole, and it will control bleeding. It will swell and it will put pressure in that area para hindi na mag-bleed. Okay, very easily used. Surgicel or fibrillar, again, these topical hemostatic agents, do you expect them to be expensive? Yes, they are. Because they are very effective in controlling bleeding. Okay? So a Surgicel in its name is actually cellulose. Okay? It becomes a gelatinous mass, which is a substrate for clot formation after blood absorption. Okay? This may be cut in smaller specific sizes before placement para sakto yung size. It is absorbable, so it can stay there, but it may promote infection. So still, you need to remove it anyway. Okay? How does it happen?
Surgicel products are ready to use right out of the package. When applied to the bleeding site, Surgicel provides a physical barrier to blood loss. As the fabric becomes saturated with blood, platelets and other blood proteins adhere to and aggregate within the ORC matrix, initiating clot formation. While at the same time, the interaction of ORC with blood leads to a localized reduction in blood pH, causing vasoconstriction and reducing the rate of blood flow to the area, enhancing platelet activation and adhesion, enabling safe, rapid hemostasis. Localized reduction in blood pH also creates an environment inhospitable to bacteria, resulting in Surgicel's proven bactericidal properties against a wide range of bacteria, including bacteria commonly associated with Surgicel. Surgicel products are ready to use right out of the package. When applied to the bleeding site, Surgicel provides a physical barrier to blood loss. As the fabric becomes saturated with blood, platelets and other blood proteins adhere to and aggregate within the ORC matrix, initiating clot formation. While at the same time, the interaction of ORC with blood leads to a localized reduction in blood pH, causing vasoconstriction and reducing the rate of blood flow to the area, enhancing platelet activation and adhesion, enabling safe, rapid hemostasis. Localized reduction in blood pH also creates an environment inhospitable to bacteria, resulting in Surgicel's proven bactericidal properties against a wide range of bacteria, including bacteria commonly associated with surgical.
Oh. So how is it used? Right here. You put the Surgicel on there. This is actually, they're comparing two products of theirs. So this one, you're already putting another one, it's still kind of bleeding. Third layer already. You're gonna put a fourth layer. Yeah. So they're continually developing their continually developing their products. You know, they're trying to compete with themselves, which is really good. Electrocautery. Electrocautery is will I say it's expensive? It's not expensive anymore. It's actually a very good way to control bleeding or superficial bleeding in your surgeries. You know, we expect bleeding usually from like the superficial vessels when we cut into the skin, the subcutaneous tissues, and that can be arrested with the simple use of electrocautery. So you can cut tissue, you can coagulate bleeding by small blood vessels by generating heat through a direct electrical current into a metal probe or wire. Though it has a limit, okay? It can only coagulate small vessels 1.5 to 2 millimeters in diameter. It can be monopolar or bipolar. This polar, dahil isa lang yung gumagana. Okay? You can have a bipolar which is shaped like a thumb forceps, wherein yung dalawang ends ng forceps ay may electricity. The cut setting, para ito ay makakat, there's usually a constant flow of electricity. Okay? Like a laser. It works like a laser. The coagulate setting, when you just want to arrest, bleeding blood vessels, the flow of electricity is stop and go. Intermittent siya. Para hindi ganun ka daling mag-heat. Okay? So as you can see, this is a bipolar. Okay? When you put them together, there's actually, more, we call this more, more electricity that goes in. Okay, bzz, bzz, bzz. Okay, I'll show you a lot of videos because this is pretty cool. Okay, how do I?
She cuts it. Oh no.
Bzz. I'm making the sound effects, sorry guys. That is actually like a cyst that they want to remove. So no need for scalpel, no need for, you know, all that bleeding, because whenever your monopolar encounters blood vessel, it what do you call this? It coagulates it immediately. Okay, so this is also good for removal of like small cutaneous masses. You know, na mga maliliit na malapit sa mata, malapit sa ilong, na you think it would be, you know, quite bloody. It's not. You could just use cautery and such. Small melanoma. Okay, oh, look at that. I think they're gonna use the bipolar again. Oh, monopolar. This is a monopolar. Okay. Zzz. It's actually the capsule of the cyst. Remember, a cyst would have a capsule inside. It's like a layer of fibrous tissue, and you need to remove that para ma-prevent mo yung recurrence ng cyst. And there's bleeding because you didn't use a monopolar for that. And that's it. And it's done. See? No more bleeding. Magic. I call that. Okay, there's another one. This is when you use a cautery to make your incision as compared to a scalpel.
Now at this point we're excising the previous biopsy tract in order to prevent tumor seeding from the previous biopsy. Now at this point we're excising the previous biopsy tract in order to prevent tumor seeding from the previous biopsy.
Okay. I hope you could hear that bzz, bzz thing, because that's so amazing to watch. And if you're wondering what it smells like, yes, it smells like you're cooking something inside a surgery room. It just smells something's burning. Parang ganun lang. That's fine. Okay, there's another example of that.
Nice silly question. If we want Kathia.
Okay, when you're trying to arrest bleeders, okay? Mga maliliit na nagbe-bleed sa skin.
Nice silly question. If we want Kathia.
Just one touch of the cautery and that's it.
Nice silly question. If we want
Oh, this is a craniotomy, I guess. Oh, shit. Yeah, it's a craniotomy. Alright, so you can see it looks like a very invasive procedure, but there's like no blood almost na nagbi-bleed because they're using electrocautery really well. Okay, so that is it for this lecture. Thank you for staying with me through module 6. I know you would be it would be very beneficial for you if you could see it for yourself. But then again, we're working through this, and you know, no one likes it. No one likes it. I don't like it. But yeah, I hope you all would stay safe and you know, take care of your families and prioritize yourselves more than anything else. Okay, you know, ACADS is just ACADS. It's not gonna kill you. The virus will kill you though. All right. Take care of yourselves. Thank you guys. Have a good week. Next week is our first lecture. It will be on Friday, April 16. That will be a release 12 noon. And yeah, instructions will follow. All right. Thank you. Bye. Magic. I love it. Right.